So we have this problem where we have a stone in the common bile duct, which was a little bit too big to pull out. Despite the fact that I did a sphincterotomy and a papillary dilation up to 10 millimeters, we're unable to extract the stone with our basket. So we're stuck. We have the basket inside the scope, inside the patient on the stone, and we can't release the stone. So what we're now going to do is the Soehendra emergency crushing procedure. First of all, with some pliers, we're separating the handle of the basket. So you have four wires making up for the basket. And we're cutting through the last wire here. So now the handle is loose. Here we have the plastic sheet and the wires. And we're going to remove the endoscope. So first, remove the guide wire. We're going to leave the metal wires in place, removing the plastic sheet here. As you can see on the X-ray, we're going to remove the endoscope, leaving the basket with the stone in place. Yeah. First we have the crushing sheet, making part of the Soehendra crushing set. And with the tip of the crushing sheet, we're going to advance it into the patient, over the 4 wires, through the mouthpiece, and on the X-ray we can see that the tip of the crushing catheter is advanced into the duodenum up to the level of the basket. Okay, next step. This is the handle of the crushing set. So we're going to advance the wires through the hole. And we lock it on the crushing sheet. Now you can shorten the remnant of the wire, but you can also wind it 1 to 2 times around the spindle. And when you're going to tighten the wires, it will lock itself. Now the trick is not to rattle, get the tension up too quickly, because then one of the snares will break. What we want is that the forces that we're going to apply on the rattle are being transferred slowly on the stone and cutting the wires through the stone. So take your time, there's no pressure. You see here the coil sheet is in position, and click by click we're going to tighten the tension on the snares. So with my thumb here on the rattle, we give some tension until we feel that there's a lot of tension on the wires, and then tick by tick we're going to get the tension up. This may take a while, but take it slow, there's no hurry. So usually this is the moment where you talk about the weekend, what your plans are, what your purpose in life is. So every 10 to 20 seconds, another tick. It's really important to take your time, keep the tension on the wire, and let the rattle do the work. And let the forces transfer through the wire, not so quickly. So now feel the tension really getting up, and either the stone will break or the wires will break. But if the wires break, it will come loose from the stone, and you can remove 4 wires and do endoscopy with EHL, for example. Or most likely the stone gets crushed and you can just extract the fragments with another basket or a balloon. So 2 minutes in, you really see the contours of the stone very well. And you also see the steel tip that fuses the 4 wires together. So either stone will break or the tip will break. We feel a loss of resistance. So here you see that the wires have gotten much smaller now. And let's see if we are able to remove it. Yeah. So I think the stone has been crushed. A lot of stone debris here, so I think it's crushed. So let's go back with the duodenoscope and see what happened in there.